So hey guys, welcome back to another video. So in today's video we are talking about a family planning method, and under this family planning method we are still under artificial family planning method, because we have traditional method of family planning and then we also have artificial method of family planning. Under artificial method of family planning we have the permanent family planning method, that is the tubal ligation. I had already talked about it. And we have vasectomy. I have already talked about it. Vasectomy is for men, tubal ligation is for women. We also have barrier method. Barrier method, we have male and female condoms, we have spermicides, we have the cervical cap, we have vaginal sponge, we have the diaphragm. We also have IUCD, intrauterine contraceptive devices. We have intrauterine contraceptive devices. Under this we have the copper T, we have Nova-T, we have progesterone. I will talk about them when I start talking about the when I will be handling that section. So today we want to talk about a hormonal contraceptive method, and we are going to start with combined oral contraceptive, because we have combined oral contraceptive, and also we have the progesterone only. Under this hormonal contraceptive method we have combined oral contraceptive, we have progesterone only, we have the progestin injections, and we have combined injectables. So we have injectables, we have pills, and we have implanon, that is Jedel, and implants, not implanon, we have implants, that is Jedel and implanon. So here let's start with the pills, the combined oral contraceptive. I will also, under this pill I will talk about the progestin only and the combined oral contraceptive, so that we get a video that is at least more compressed. So let's start with combined oral contraceptive, and in the same video I'm going to talk about progestin only, so that you know it. Let me go and bring something, then I'll continue. So I want to say that hormonal contraceptives are methods which are synthetic. They are systemic. I mean, not synthetic, they are systemic in nature and contain neither progestin with estrogen or progestin alone. And I've said we have the oral contraceptives, we have progestin only injectables, and also we have implanon. And I've said I'm going to start with combined oral contraceptive. So under combined oral contraceptives, it is made up of combination of synthetic estrogen and progesterone hormone that are highly preventing pregnancy. So under this combined oral contraceptive we have monophasic. Those things really important about this. We have different types. We have the biphasic, we have the monophasic, we have triphasic, and this one I don't think. Okay, let me just talk about them so that you know. So monophasic, all 21 active pills contain the same amount of estrogen and progesterone dose combined, because I said it is combined oral contraceptive. So we must have the progesterone, the same amount of progesterone and with the estrogen. Now under biphasic, the 21 active pills contain 2 different estrogen and progesterone doses combined. And then triphasic, we have 21 active pills containing 3 different estrogen and progesterone doses combined. Out of the cycle of 21 active pills, 6 might contain one combination. 5 pills may contain another combination, while 10 pills can contain another combination of 2 different hormones. So monophasics, these pills are 28. The pills with what am I saying? I'm saying monophasics. Under monophasics now, these pills with are commonly used, are preferred in our country. Yeah, they are preferred in our country, and they are also available. Example, we have Lefamode. I don't know if I'm pronouncing it right, but that is the name. So we have the 21 pills, and also we have the 28 pills. The 21 pills, where pills is taken for 21 days, and you have a break of 7 days, and within these 7 days you are expecting your monthly period. After that, you will start taking the pills again. Then we also have the 28 pills, where a hormonal pill is taken for 21 days, and the remaining 7 pills contain iron, and you will take them as you wait for your monthly period. And most of the time, these 28 pills are being given to a person who cannot. If this person stops taking medication, she will forget forever. That is why, so you will be given 28 packets, so that you don't get a drug break as you wait for your monthly period. So I think I have some sachets. I'm going to show you how the 21 pills look like and the 28 pills look like. Yeah, this one is 28 pills. This one is 28 pills. This one is 28 pills, and this is how it look like. These ones are the iron. You will take this one for 21 days, and then after that, as you wait for your monthly period, is when you will start taking this, because you cannot remember. If you stop taking drug, you will not remember how you used to take them. That is why sometimes somebody can prefer this. I don't know if you're getting. Let me see if I can switch off the light. You see it clearly. I think you are seeing it. Yeah, you are seeing it. Then let me go and bring another one. I thought I was carrying it, and I was carrying something different. Yeah, this is it. Kindly bring for me the other one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. This one is 21 days, and the arrow here is showing how you should take them. Now, let's look at how these contraceptives, these oral contraceptives work. Number one, how they work, they slow down the motility of the fallopian tube, thus delaying the implantation. They slow down the motility of the fallopian tube, thus delaying implantation. The next thing that they do, they suppress ovulation, and therefore, if you are not ovulating, it means that the ovum won't be released from the ovary to get fertilized along the fallopian tube. They also thicken the cervical mucus, thus preventing the penetration of what? Of sperms. If the cervical mucus is thick, the sperms cannot pass through, so that it can fertilize the ovum. Another thing that they do, they make endometrium less favorable for implantation. They make sure that after fertilization, in case fertilization occur, now the implantation will not take place because the endometrium is not favorable for fertilization. Let's look at contraceptives benefits of combined oral contraceptive. We are only in this video we are only discussing about this combined oral contraceptives and progesterone only. I don't know if the video will be long, so that I cut it into two parts, but if it is long, I will do so. So contraceptive benefit, these combined oral contraceptives are highly effective when taken correctly and consistently. That is something that is very important. If it will be highly effective if it is taken correctly, consistently. The way your healthcare provider, the nurse, the person who gave you those contraceptive has advised you to do. Then they are effective immediately after 24 hours. If you start taking oral contraceptive right now, maybe let me say you start taking oral contraceptive after let's say you have taken it at 8 p.m. then the next day 8 p.m. you will start being infertile. So majority of women can also use this combined oral contraceptive because it is not difficult to use if you know how to follow instruction. The light and this thing cannot go, they're not giving, so it is easy to use, so most of the women can use it. They can also be given by somebody who is non-clinician, because you just explain, and maybe all the leaflet sometimes is having, not sometimes, most of the times, not most of the time, the leaflet usually have the instruction how somebody should use the drug. So somebody who have just gone to school, who have some little knowledge, can read that leaflet and understand how to use this combined oral contraceptive. So that is something that is also very important. There is no pelvic exam that is needed when you want to use this combined oral contraceptive. They do not interfere with the intercourse. They don't interfere with the intercourse. And then when the client wants to get pregnant, the client can just stop them at any time and the client will get pregnant. Now let us look at the non-contraceptive health benefits. You know, when I was doing this video I was talking about family planning. I just brushed off. Now in this pregnancy series we are going to talk about them in details. Even if I get tired, I will not do it today, I will do it tomorrow, so that you get almost every point that is very important. There are some of the non-contraceptive benefits that someone can do can get from this combined oral contraceptive. Number one, they reduce the menstrual flow. They reduce the menstrual flow. They make the menstrual flow lighter, shorter, and now by doing so they prevent anemia. Yeah, they prevent anemia, that is the iron deficiency anemia. And then also they reduce the cramps. If you want to reduce the cramps, you can use some this combined oral contraceptive. Also they reduce symptoms of endometriosis. They reduce the symptoms of endometriosis. If you don't know endometriosis, if you don't know it, I will explain it in another video, so make sure you watch all my videos. They also prevent anemia. I've already said that they prevent anemia. They reduce ovarian cancer. They decrease menstrual cramps. and also they treat acne. Those who have stubborn acne, you can use this. You can go to your healthcare provider so that you see. Loretta, keep quiet. Stop making noise. That is how it is. So they also reduce stubborn acne, and that is those are some of the health benefits. Now let's look at, because you know everything that is artificial has some disadvantages that sometimes the doctor will advise you not to use them if you have those, if you are at risk of those health disadvantages. Now they can bring nausea and vomiting. They can bring slight headache. They can bring tenderness of the breast. Those are some of the disadvantages. And also, if not used effectively, the pregnancy prevention cannot be effective. If you don't use them right, you can get pregnant. We have some serious side effects. We have some like stroke, we have blood clot, we have heart attack, we have brain and lung tumors, and also liver tumor, though they're rare but possible. If you just hear something that if they're rare but possible, you should just avoid using them. And also they don't prevent HIV and STIs. Yeah, they don't prevent HIV and STIs. So let me talk about the management of the side effects, because I said it has some disadvantage. About the nausea and dizziness, you should, if you are a healthcare provider, you should assess for pregnancy. You should ask the client if the client are getting her menses, and if not, you should take her for pregnancy test. Also spotting, assess for pregnancy. Advise the client to take the pills with meals, yeah, or at bedtime to avoid those nausea and vomiting. If the client is getting amenorrhea, assess for pregnancy. Don't assess for pregnancy, because sometimes maybe the client forgot to take the pills as prescribed and the client got pregnant along the way. Another thing that is very important, take one pill each day, preferably at the same time. Each day at the same time. If you've decided that you want to take this pill at around 2 p.m. or let me say 8 p.m., please take it every day at the same time. Take the pills. Take the first 7 pills on the first of the 7th day. First day is preferred after the beginning of the menstrual period. After the beginning of the menstrual period. So I think your healthcare provider will advise you on how to take these pills, and usually don't go away with the pills if you don't know how to take. Ask them questions. Ask them to teach you how to take those pills. Ask them to tell you some of the side effects that you will experience. Ask them to tell you the risk factors, the major risk factors like stroke, those that you might get. They are rare, but you might get them, and you find that some nurses doesn't explain everything that a patient might get when they take this. They might give you the instruction how to take them, but telling you about the side effects, sometimes they don't. So ask them about the side effects, so that even if you are taking them, you already know the side effect. You already know the risk factors. You already know how you can manage all these risk factors, or the side effects that might set in. So I think I've reached the end of this video. I'm tired. I've reached the end of this video. So if you are a returning subscriber, thank you very much. If you are new here, make sure you follow all the content that I've created, and we are free to communicate in the comment section. We have our email, we have the same name that we are using all over the platform. So yeah, don't just keep quiet and dying with something that I might give you information about it. So bye, let's meet in the next video.